Hello, everyone. As always, welcome to Dr. Kim's Dental Radiology or Oral Radiology channel. In today's video, the interesting feature that I wanted to share with you is in the area of airway. I know airway is a hot topic in dentistry, at least in the field that I'm in and the colleagues that I'm working with. I always tend to get involved with airway-related orthodontic research projects. So I'm quite familiar with the types of research that's going on in this area, as well as I get a lot of referrals from orofacial pain doctors who make mandibular advancement device for patients with mild to moderate sleep apnea. Not to mention that when I was a resident at UCLA, my research projects was evaluating the changes in the airway patient who was undergoing mandibular advancement device. And that was back in 2014, 2015. So I'm very familiar with this area. I have been engaged in this type of research project for a good number of years. We're looking at about 7 years so far. And let's see, what makes this case unique is that just the amount of, just the amount that this patient has been able to retract his or her tongue. It's very common, actually it's very common while the patient is undergoing scan that they tend to retract their tongue and hence narrowing the airway, but it's relatively uncommon, I would say. At least I haven't seen one like this for a while, where they retracted the tongue so much so that it pushed the soft palate posteriorly, and now it's in contact with the posterior wall of the oropharynx. So from this particular sectional view, the sagittal view, there's a complete constriction of the oropharynx. Of course, when we look at the axial plane, the oropharynx has been divided into two, excuse me, right side and left side, divided by the soft palate and uvula. As you know, the prevalence of obstructive sleep apnea increases with patient age for a variety of reasons. Weight gain, that's probably one of the biggest factor, but also loss of muscle tonicity as we age is another factor. And also OSA is associated with male gender and the neck size as well. But another thing is that this patient, if I recall correctly, is in his or her 20s or 30s. And so again, to see this much of narrowing and constriction of the airway in a patient who's relatively young was a striking radiographic and clinical feature for me. I don't know if I'm imagining myself, but even the soft palate looks very like elongated all the way and stretched all the way down here. I am almost certain, I would think at least, that this patient probably snores during sleep and is at the high risk of developing obstructive sleep apnea down the road, if not has, mild condition already. So, that's another thing that we kind of watch out for in a patient, not only that assessing for hard tissue, including, dentition and surrounding bone is important, but I also try to look at the overall size and shape of the airway in all of cone beam CTs that I evaluate. So what could we do, or what should we do when we see something like this? You could certainly correlate with any clinical symptoms of obstructive sleep apnea. You can Ask whether patient is aware of snoring. If so, is it mild or heavy? You can certainly ask if they tend to wake up at night. If so, how many times? And daytime sleepiness is another thing. And also early morning headache immediately after waking up. So some of these are, important clinical findings that may suggest the finding of obstructive sleep apnea. Of course, if you want to diagnose it, then patient needs to go through polysomnogram or polysomnography, where they do a sleep study overnight at a sleep center, and they're going to really assess the quality of the sleep and different stages of the sleep that you go through. And while I'm not true expert in that area, there's REM stage and non-REM stage, and I think there's like a 5 or 6 different steps or stages of sleep. So that's something that they can find out. In addition to that, they will obviously check your breathing rate and pulse oximeter and all of that to figure out like how many times you're stop breathing, and if so, how long. So all these data are gathered during polysomnogram. Nowadays, home sleep study is gaining popularity because people don't sleep very well at a sleep center. I've done that once for myself, and I think I got the worst quality sleep. So I don't know how accurate the result is when you know that that's not usually how I sleep. So now they have you take this sleep study kit, and you can actually sleep from your home. And it still is actually uncomfortable because you have all these different wires that again, and straps that go around your chest and belly and so forth. But I think it still improves the overall experience because you're able to sleep at your home rather than at some random sleep center that you have never spent any time in. Anyway, this is just all I wanted to share with you. And if you have any questions regarding obstructive sleep apnea, feel free to leave a comment in the comment section. Thank you very much and take care.